Hey guys, welcome back to my channel once again with another new topic. So today we are going to discuss regarding biochemistry practice MCQs part 6. So in this video we are going to discuss regarding lipids and lipoproteins and also endocrinology, that is hormones part, and also tumor markers, and also with some MCQs of vitamins. Okay friends, so hope you are liking my previous all the biochemistry MCQs videos. So please do like, share and subscribe to my channel. Keep supporting me, and let's get started with our today's video. So today our first question is, high levels of which lipoprotein class are associated with decreased risk of accelerated atherosclerosis? Option A chylomicrons, option B VLDL, that is very low density lipoproteins, option C LDL, that is low density lipoproteins, and option D HDL, that is high density lipoproteins. So the right answer is option D, that is HDL, that is high density lipoproteins. Okay friends, let's move on to our next question. Transportation of 60% to 75% of the plasma cholesterol is performed by option A chylomicrons, option B VLDL, option C LDL, and option D HDL. So the right answer is option C, low density lipoproteins. They will transport 60 to 75% of the plasma cholesterol. Okay friends, next moving on to our next question. In amniotic fluid, the procedure used to determine fetal lung maturity is option A lecithin and sphingomyelin ratio, option B creatinine, option C measurement of absorbance at 450 nanometers, option D alpha-fetoprotein. So the right answer is option A, that is lecithin and sphingomyelin ratio is the procedure used to determine the fetal lung maturity. So the next question is, turbidity in serum suggests elevation of what? If you see a more turbidity in the serum, what will be the suggestion? Option A cholesterol, option B total protein, option C chylomicrons, option D albumin. So the right answer is answer C chylomicrons. If you see the more turbidity in serum, then it is a cause of option C, that is chylomicrons. Okay friends, moving on to our next question. TSH is produced by, what do you mean by TSH? That is thyroid stimulating hormone, right? So it is produced by option A hypothalamus, option B pituitary gland, option C adrenal cortex, and option D thyroid. So the right answer is option B thyroid. Next, moving on to our next question. A patient has the following thyroid profile. So it's a kind of case study question. Total T4 will be decreased, free T4 will be decreased, thyroid peroxidase antibody is positive, and the TSH is decreased. The patient most probably has option A hyperthyroidism, option B hypothyroidism, option C a normal thyroid, and option D Graves' disease. So on going through this patient thyroid profile, what will be the patient condition? So the right answer is option B hypothyroidism. Okay friends, moving to the next question. It is also a kind of case history type. A 45-year-old woman complains of fatigue, heat intolerance, and hair loss. Total and free T4 or abnormally low. If the TSH showed marked elevation, this would be consistent with what? If the patient is having these kinds of symptoms, then what will be the cause? Option A Graves' disease, option B an adenoma of the thyroid, option C thyrotoxicosis, and option D primary hypothyroidism. So the right answer is option D, that is primary hypothyroidism. Next, moving on to our next question. The majority of thyroxine, that is T4, is converted into more biological active hormone. Option A thyroglobulin, option B thyroid stimulating hormone, that is TSH, and option C Tri-iodothyronine T3, and option D Thyrotropin releasing hormone. So the right answer is answer C, that is Tri-iodothyronine. Okay friends, moving on to our next question. A 2-year-old child with a decreased serum T4 is described as being somewhat drafted, okay, stocky, overweight, and having coarse features. Of the following, the most informative additional laboratory test would be the serum For what? Okay. Option A, thyroxine binding globulin, that is TBG. Option B, thyroid stimulating hormone, that is TSH. Option C, Tri-iodothyronine, T3. And option D, cholesterol. So it is also a kind of case history. Here they are asking regarding the 2-year-old child. Okay friends, what will be the cause? So the right answer is option B, thyroid stimulating hormone. Moving on to our next question. The recommended initial thyroid function test for either a healthy asymptomatic patient or a patient with symptoms which may be related to a thyroid disorder is option A, free thyroxine, that is free T4. Option B, thyroid stimulating hormone, that is TSH. Option C, total thyroxine, that is T4. And option D, tri-iodothyronine, that is T3. So the right answer is option B, thyroid stimulating hormone. Next, moving on to our next question. This is also a kind of case history question. A 68-year-old female patient tells her physician of being cold all the time and recent weight gain with no change in the diet. The doctor orders a TSH level and the laboratory reports values are, that is 8.7. Okay, 8.7. And this patient most likely to have what? Option A, primary hypothyroidism. Option B, Graves disease. Option C, a TSH secreting tumor. And option D, primary hyperthyroidism. So after seeing this case history of a 68-year-old female patient, this can be the cause of option A, that is primary hypothyroidism. Next, moving to the next question. Which of the following is secreted by the placenta and used for the early detection of pregnancy? Okay, option A, follicle stimulating hormone, that is FSH. Option B, human chorionic gonadotropin, that is HCG. Option C, luteinizing hormone, that is LH. And option D, progesterone. For early detection of pregnancy, we will use the HCG only. Yes, HCG hormone, that is option B, human chorionic gonadotropin hormone. Next, moving to our next question. During a normal pregnancy, quantitative human chorionic gonadotropin levels peak how many weeks after the last menstrual period? Option A, 2 to 4. Option B, 8 to 10. Option C, 14 to 16. And option D, 18 to 20 days. Right, 20 weeks. So the right answer is option B, 8 to 10 weeks. Okay friends, next moving to our next question. Night blindness is associated with the deficiency of which of the following vitamins? Option A, vitamin A. Option B, vitamin C. Option C, niacin. Option D, thiamine. So the night blindness is associated with which of this following deficiency of the vitamin? So the right answer is option A, that is because of the vitamin A deficiency they may cause the night blindness. Okay, next question. Beriberi is associated with the deficiency of what? Option A, vitamin A. Option B, vitamin C. Option C, niacin. Option D, thiamine. So the right answer is option D, thiamine. Beriberi is associated with the deficiency of vitamin thiamine. Okay friends, so these are your MCQs, that is practice MCQs from your part 6 MCQs. So hope you like it. Please like, share and subscribe to my channel. Keep supporting me. See you soon in our next video. Thank you friends.